My name is Anne Stauffer. I'm the Director for Strategy and Campaigns at HEAL, and I lead our Climate and Air Quality program. And I'm joined here today by the HEAL Poland team, Veronika Michałek and Jacek Karachun, and also by Aleksandra, HEAL's media coordinator. And I'm delighted to see that so many of you are interested in talking about climate change and health issues in Poland. We've had over 60 registrations to this webinar, and I think more people will be joining as we continue the conversation. Actually, today's webinar is the first in a series of exchanges that we're organizing throughout the month of September. And we're organizing this exchange in view of the growing interest of the Polish health community to talk about climate change and issue, but also because of the ongoing need to share information and share good practice with the international and with the global health community. Climate change is considered the greatest threat to public health of the 21st century. And it has affected people's health in Poland and the European region already before COVID-19 hit. But the current pandemic has placed health concerns central on the agenda for policymakers and the public alike, and has made clear that efforts for disease prevention and greater health and healthcare resilience need to be strengthened. For over a decade, my organization, HEAL, has worked to raise the awareness on the health impacts of climate change and engage the health sector on activities to reduce the carbon footprint and prevent ill health. From a handful of health representatives back at the COP in 2009 at the UN climate talks, health engagement on climate has grown into a global movement 10 years later, with institutional health actors such as the World Health Organizations or health ministries active, but also civil society quite engaged on this issue. And health engagement in Poland has also grown. We saw the first ever conference on climate change and health at a COP in Katowice 2 years ago, followed by a series of reports and information material, and recently the launch of a working group on climate change and health. And our webinar today is actually very timely, because just today, the European Environment Agency has released a new report on health and environment with evidence on how climate change, especially heat waves, affect our health, and a wealth of data on why a healthy environment is necessarily to have healthy people. So there's a lot to talk about. And I'm pleased that we have this exchange with our renowned speakers today and you as participants. So before we start, I would just like to make some housekeeping rules. For those of you who just joined, this is a webinar with simultaneous translation English into Polish. If you go to the bottom of your screen, you'll see an icon that says interpretation. If you click on the English item, you'll have the translation in English. And if you click on the Portuguese item, you will have the Polish translation. Unfortunately, there's no icon for the Polish translation. And if you have any questions or comments, please send them either in English or in Polish via the Q&A box, which is also at the bottom of your screen, at the bottom right. We will be reviewing your questions in English and Polish. And let me just actually share my screen where we also have this announcement in Polish. Here we go. So it will not be possible to ask a question directly with a microphone, but do share your thoughts, any questions you have, please, with the chat, and we'll be presenting them and right after the presentation or then at the discussion at the end. So we will have 1 to 2 clarification questions after each presentation, and then a longer discussion following all of our distinguished presentations today. We will also be recording this webinar, and it will be made available for you afterwards on YouTube. And we'll also be looking at bringing together a linked list for further information of things that are being discussed in this webinar today. If you have any technical difficulties, please contact my colleague Jacek, for those of you in Polish, and for English participants, Elke is there to help you with any problems. And now I'm pleased to give the floor to our keynote speaker, Dr. Nick Watts, the Executive Director from the Lancet Countdown, which is a unique interdisciplinary research collaboration tracking climate change and health across 40 indicators. And Nick, you'll present to us the latest data on climate change and health and maybe give us a glimpse of what will be in this year's Lancet. And let me just stop sharing my screen so they can go ahead. A warm welcome, Nick, and the floor is yours.
Hi, thank you very, very much. I'm going to talk, but I'm hopefully not going to talk for too long, because I think we have some really fantastic experts on the panel that can probably talk in greater detail than some despot Australian stuck in London. My name is Nick. I work with something called the Lancet Countdown. We do a really simple thing, exactly as Anna said. We track the relationship of public health and climate change. We do it across 196 countries. Every single year, we come back and we provide an update on what the climate has been doing to human health in the last 12 months, but also how we, our health systems, our energy systems, our food and agricultural systems, our cities, our communities, how we have been responding and what the health implications of that have looked like as well. I'm only going to talk for sort of 10, 15 minutes, but really, to be honest, there's only 3 things I'm going to say. And in some ways, they're pretty straightforward, pretty simple things, actually. The first thing I'm going to say, and I'll talk a little bit around the evidence for this, but the very first thing is around the impacts of climate change on human health. The first thing to remember is that these impacts that we're talking about, they're not something anymore that we talk about in 2050, 2070. We are seeing the health effects of climate change around the world in every single country today. In fact, the life of a child born today in September, sometime in 2020, it will be profoundly affected by climate change without further action. That's the first thing. Second thing is we have known about this for a very long time. That's kind of my point. This isn't anything new. This isn't anything revolutionary. We have known for 2 decades, for 3 decades, that climate change is impacting on human health. There have been some really impressive people, many of them on this call, and really impressive institutions. The Health and Environment Alliance is globally a standout that have done an enormous amount to respond. But at the global level, at the international level, broadly, we have not done that much to respond to climate change. Impact, delay, opportunity. Just in the last couple of years, I think just in the last 5 years, we are starting to see a shift in the way that the world is thinking about climate change. We are starting to see these glimmers of hope that are emerging. And I have been saying this now for a few years, and the reason I keep repeating myself is because year on year, the data that we have, that we pull together, keeps bearing itself out. We keep seeing the same trends and the world keeps heading in those directions. And those opportunities that we start to see, I think are really something that is very exciting and worth writing home about. So that's my opening piece. That's what I think I will talk about. If you speak Australian, you will have understood what I said. If you speak English, you may have understood what I said, although my accent is difficult. If you speak Polish, I'm sorry, I don't speak any Polish. And the interpreters, although I'm sure they are incredible, perhaps can't understand my Australian accent, so I apologize. But bear with me. This is us, this is a countdown. We do that simple thing. We put our finger on the pulse of the planet. We track anything from extremes of heat, the spread of chikungunya, the spread of malaria, the spread of dengue fever, through to what is happening with global diets around the world. We look at emissions from agriculture and from food, both in the country where it's produced and the country where it's consumed. And then we look at the health effects of both of those ends of the spectrum. We are a collaboration of far, far, far too many different groups scattered across the world. We agree on basically nothing. In fact, it is remarkable that we managed to agree on this. And I think that probably speaks to our strength. We spend an entire year arguing over this data every single year, and then come together to put out this report. And this is about all that we managed to agree on. The only thing I should say is that all of the data, absolutely everything, so we provide everything by WHO region, we provide it globally, and we provide it nationally. Everything is available online. You can find us at lancetcountdown.org. All of our data, we have a new data visualization platform that will allow you to go through and figure out precisely what is happening in your country. And if you're Australian, maybe you're interested in how that compares to what's happening in New Zealand and whether we're doing better than them. So I said I had 3 things that I needed to say, and I meant it. The very, very first thing, the first take home, the human symptoms of climate change, they are unequivocal, they are potentially irreversible, and they are affecting populations around the world today. In fact, the life of a child born today will be profoundly affected by climate change. That child born today, without further action, they will grow up in a 4-degree world. Now, we have a vague idea from the data of what that looks like from a climate perspective. We spent quite a bit of time studying this. I don't really think we know what a 4-degree world looks like from a public health perspective. But we do know that when we were training in medicine and when we were training in healthcare and when we were building our health systems, we were building them with the understanding that the climate would be stable. They are not prepared for this new world. And so that's looking forward, but maybe just looking at present day, and the data we have in front of us is for 2018. 2018, we saw an additional 220 million vulnerable people around the world exposed to extremes of heat. That's bad because that has all sorts of implications for congestive heart failure. It has implications for kidney disease, but it also has some pretty profound implications for some very vulnerable populations. And those are people who are either migratory, they are populations who are engaged in physical manual labor outdoors. There we saw 133 billion work hours lost in 2018. All of this rising drastically over the course of just 2 decades. Around the world, you're seeing those effects, concentrated, as you can imagine, where the populations are. So India, China, Pakistan, as you can see on screen. But importantly, you'll also note that Europe is not safe from this. Europe is also being affected by these extremes of heat. And exactly as the Commission said today, that's one of the biggest, I think, concerns for the continent. Again, focusing on present day, up to present day, we see a shift in global yield potential for maize, for winter wheat, for soybean, for rice. These are some of the crops that we track, looking at the climatic conditions around the world and the bread baskets, the places where it really matters that we have access to this kind of food. Projecting forward, so we see these percentage reductions and they're quite profound, but maybe if we're interested in also the health implications of that. Projecting forward, you would expect under a business as usual scenario that you would see an extra 32 million children under the age of 5 malnourished across sub-Saharan Africa by 2050 as a result of climate change. That number goes up to about 40 million when we turn to Southeast Asia. These are really, really enormous, profound numbers, I think, that we are starting to see the implications of today. And then I briefly discussed climate suitability. I talked about dengue fever and malaria. This graph just draws out just two vectors, Aedes aegypti and Aedes albopictus. We've created a logistic model that is fine-tuned to dengue fever. We're looking at the climate signal, right? So we know that dengue fever has been increasing, incidence of dengue fever has been increasing around the world. In fact, it's one of the most rapidly growing long-term infections. What this graph attempts to do is isolate the climate suitability, isolate the climate signal there. We see that just recently, the second highest on record for the transmission of dengue fever was in 2017, and 9 out of the most 10 suitable years for its transmission occurring since 2000. An enormous, enormous spike when you go back to a stable baseline in the 50s and 60s. So we know that climate change impacts human health profoundly. We know that it does so irreversibly, and we know that it is doing that today. The unfortunate thing is that we have known that for quite some time. So I said impact, delay, I think, is the second thing we need to remember. the delayed response to climate change over the past 2 decades, over the past 3 decades, really, has jeopardized, I think, human life and human livelihood. This here is a graph of carbon intensity of the global energy system. So just for a second, trying to ignore everything and just focus on that little black dotted line running through the middle there from about 1990 to 2017. That is the carbon intensity of the global energy system. You will see that it has broadly remained flat. Given that emissions are cumulative, as the energy has remained flat, the intensity of the energy system has remained flat, and the quantity of the energy system has increased, carbon emissions have shot up. And so the entire time that we've been aware of this, we've seen carbon emissions continue to rise. Now, that masks some underlying changes. We see the United States, we see North and Western Europe decreasing their emissions, but that is counteracted very, very strongly by what we see in Southern Asia, which by that we mean India for the most part in that trend, and China, who have drastically increased the carbon intensity of their energy system. Equally not met with a strong enough reduction from the United States, from Australia. So I said there were 3 messages: impact, delay, and optimism. I think since 2015, 5 years ago, since we signed the Paris Agreement, and quite a few of us, I think, were probably in Paris together. It felt like quite a special moment. There have been in a couple of key areas that are really, really important for human health that we have started to see progress. And the reason that's important is because it turns out that when you take everything you might want to do to respond to climate change and you put it in a basket or you write it down on a piece of paper, if you are a doctor or a nurse or a physiotherapist or a public health professional, you'll look at that and you'll say, well, that doesn't look like a climate change intervention. You're just talking about cleaner air, or you're talking about healthier diets, or you're talking about more livable cities. And it turns out that's all we are talking about. We are starting to see that second path emerge, and I think we are starting to see it as it applies to energy systems, as it applies to transport, and as it applies to the healthcare system itself. And if we do it right, that second path, that child that's born today, they will live and experience a profoundly different life. They will go from a world with heat wave and extremes of heat that make physical labor difficult, and food insecurity and the spread of infectious disease, and they'll shift into a new world where they don't just have the ability to survive, but instead the ability to thrive with cleaner air, healthier diets, more livable cities. So to back that up, we start to look at data of electric vehicles and the air pollution reductions that we see. We have seen around the world electric vehicles have reached cost parity with their non-electric counterparts 2 years ago. That's pretty remarkable. We didn't expect that to happen until 2036, but it happened 2 years ago. Turns out the technology drastically outpaced the ambition of governments because there was a demand for this, because it turns out that electric vehicles, they are healthier. And so you are starting to see that. The country where the greatest demand for electric vehicles are per capita, Finland. Immediately behind Finland, though, and this is per capita, is China. And I think there are some really exciting trends there that we are starting to see around the world. It's really quite impressive. Now, those advances in electric vehicles, they are good because climate change is bad, and climate change is bad for health. But what we also see is that they result in improvements in air pollution. This graph is a little bit tricky, but effectively it's giving you 2 years of air pollution. It's giving you the health costs for 2 years of air pollution in Europe, 2015 and 2016. Broadly across Europe, we saw improvements in air pollution. Now, they are fairly modest improvements, as you can see, but they are improvements nonetheless. Just those improvements that we saw across those 2 years, they result in a Europe-wide annual saving of 5.2 billion euros from reductions in life years lost. It's an enormous progress if you hold that progress through the course of someone's lifetime. Now, Europe wasn't even trying back in 2015 and 2016. So you just have to imagine how much else it could do if we take a little bit further action. The final area where I think we are seeing some really exciting, really impressive progress is in the healthcare sector. This here is a global map. On the y-axis, we have a measure of health quality, a measure of how good your healthcare system is at turning resource into healthcare. Along the x-axis, we have per capita healthcare emissions, and we track this for every country in the world. If I populated this with every other country, what you would see is that there is a relationship between carbon and healthcare quality up until about 450 kilograms of CO2 equivalent per person. And beyond that, it breaks down. It turns out that France can deliver healthcare that is just as good as Japan can, or just as good as the United States can, with considerably less emissions per capita. And the healthcare quality doesn't suffer at all. It's about the structural ways that we think about this. With that in mind, we are starting to see health systems around the world really start to respond. We are starting to see hospitals in the United States, in the Philippines, clinics, primary care clinics in Malawi and in Australia start to embrace what a sort of sustainable development response to climate change looks like and build sustainability into their healthcare thinking. In the United Kingdom, where I am at the moment, they've gone one step further. The NHS has declared that it's going to get to net zero. It wants to be the very, very first health sector, the entire system, to get to net zero. It's trying to figure out how it's going to manage to do that, and I think that's a really impressive challenge. But wow, if you could have a hospital that is a net zero hospital, the world's first net zero ambulance, there's a really important, really impressive thing that we could start to see there in terms of the moral leadership that we as health professionals could bring. What is really great about that, though, is that they've already started. They've actually already managed to reduce their emissions by quite a bit over the last decade. And the learning that they've had as they did that was that it turns out that it improves patient outcomes, it actually saves on cost, and it improves staff well-being. Everyone ends up winning when you start to combine those different imperatives together. So that's 15 minutes. It's about 16 minutes, I lied. But I promised I would be short. 3 things that I think we need to remember. They will be the same 3 things in 2020 and in 2021 and in 2022. The health impacts of climate change are unequivocal, they are potentially irreversible, and they are affecting populations around the world today. We have known this for 30 years and we have not done enough to respond to climate change. And just in the last 5 years, on transport, on energy systems, in air pollution, and in the healthcare system, I think we are starting to see a sea change and some really impressive, really important changes that we're starting to see that we should be proud of as a health profession. That's all I have, other than, Anne, I know you want to move on, but I need to say thank you to everything, to you and to HEAL for everything that you guys do. It's so fantastic to see everything that HEAL manages to achieve across Europe. It's you guys are a leading light for us to follow. So thank you.
Wonderful. Thank you very much for that, Nick. And thank you so much for your presentation and your very clear messaging as ever, which was a really good kickoff into a whole series, as I think you started to outline the issues that we'll be looking into more detail throughout this series. And I was quite pleased to see that you ended with this positive message that change is possible. So very good. I want to encourage all of you participants to share your thoughts, raise any questions. You have the Q&A function where you can type away, either in English and Polish. And now I would like to turn to our next speaker, which is Professor Szymon Malinowski. Very welcome. Professor Malinowski is director of the Institute of Geophysics at the University of Warsaw. So you're a Polish atmospheric physicist, a professor of earth science, correspondent member of the Polish Academy of Science. And you're also the protagonist of the documentary that I've had the pleasure of watching recently, It's Okay to Panic, which I can recommend for all of you to have a look at. And I'm very pleased that you are with us this afternoon, and looking forward to hearing more about your engagement activities on raising the awareness on climate change and what we need to do. Thank you.
Yeah, thank you very much. Thank you, everyone. You are physicians, I am physicist. So we have something common, and I will talk a bit about some physical basis of climate change and why it's so difficult and so important for our future. So my slides are mostly in Polish, but I will speak in English. So I try to share slides. 1 second. Yeah, I hope you can see my slides. So I will talk about mechanisms and perspectives related to global warming. And Nauka o Klimacie is a Polish webpage. If you have any questions, you should ask Nauka o Klimacie. We know almost everything about climate, but unfortunately we are devoted mostly to Polish audience. Okay, so generally the story is the following, that we have the planet Earth, which has certain temperature, T2 here on this slide. And what governs the temperature of our planet? There is just an energy balance. How much energy is being absorbed, solar energy, and how much energy in terms of infrared radiation is being emitted to space. And depending on the sign of the balance, the temperature grows. If we have, incoming solar radiation bigger than outcoming infrared radiation, and temperature grows, increasing radiation, and then balances the effects. So this is true for all the planets in the universe. And we have two celestial bodies which receive the same amount of solar energy. And you see that the climate and temperatures on these bodies are very different. So this is very important, not only income of the energy to the energy balance, but also outflow of the energy to space. And what makes the difference between the Earth and the Moon is just a very tiny layer of the atmosphere, which makes this transmission of energy outgoing to space different than transmission of energy going into the climate system. So you have here this energies, but energy is being carried by electromagnetic radiation. And you know that electromagnetic radiation has different properties depending on their wavelength. You use X-rays or tomography to look into the human body, since X-rays can penetrate the human body. So the solar radiation, as you can see on the screen, can penetrate the atmosphere and can be absorbed on the Earth's surface, while the radiation emitted from the Earth's surface hardly penetrates the atmosphere because of different wavelengths. And because of the fact that some rare gases in this atmosphere, minute gases, just a tiny amount of the atmosphere, gases which have three atoms in a particle or more, can absorb this radiation, and it makes a kind of a blanket of our Earth, which makes it the kind of control knob of the climate. Since we have more or less constant amount of solar energy coming to the Earth, and turning this knob on and off makes a difference in the way the energy is being transferred to the outer space. And we call this effect greenhouse effect, since it's like in the greenhouse, which prevents heat from being emitted from the greenhouse outside. So this plot is pretty complicated. It comes from IPCC report and many other reports, and is showing us the energy in watts per square meter of the planet Earth, and the actual energy balance and energy transfers in the climate system. So generally you can see on the left-hand side incoming solar radiation, and on the right-hand side this infrared radiation being emitted to space. And you can read this picture, which is pretty complicated, that in top you have outer space and sun. On the bottom, you have the Earth's surface, and in the middle, you have the atmosphere. So you have incoming solar radiation, which is partly reflected back to space by clouds and the atmosphere, and partly by Earth's surface. And part of the energy is being absorbed by the atmosphere and by the surface. The surface becomes warm and starts to emit this infrared radiation, which is partly absorbed in the atmosphere. Atmosphere becomes warm and then emits some radiation back to space, which to Earth's surface, which makes the Earth's surface warmer, and some energy back to space. If you make a total balance of the energy, you can see that now the Earth is out of balance. It absorbs more energy than emits to space, and the amount is 0.6 watts per square meter of the Earth. And this is due to increasing amount of greenhouse gases, which make the transmission of the energy into the outer space more and more difficult. So it's being kept in the climate system. So this is the mechanism of the climate warming we have now. We increase the amount of greenhouse gases, and this prevents excess heat and excess energy to being transferred to space. So generally, we can observe it in the atmosphere, looking for the temperature of the air close to the Earth's surface, and you can see different series made by statistical interpretation of the majority of the atmospheric measurements all over the world. And we see that at least in the atmosphere, we have a constant growth with some fluctuations of a temperature with respect to what was, let us say, 100 years ago. So we have positive energy balance, and as we expect from the positive energy balance, we have increasing temperature. But this increasing temperature, you can see on this plot, creates some unusual, effects. If you can see here in this plot, years 1950, 1980, which are more or less here. And then you can look for the, let us say, each square on the land surface in the northern hemisphere in this time. And you can take, for instance, summer temperatures. So you can get a distribution of something which is typical and non-typical, warmer or colder than the average for a given geographical location. And if you make such a statistics from 30 years of climate from this period about 40 years ago, when we had very small fluctuations of the temperature, you can see pretty nice Gaussian distribution. And if you make the same exercise for last 10 years and compare it to what was just, 40 years ago, you can see that we have extreme events which occupy 14% of the all cases we recorded. So this is very, very warm events during summer. So the problem is not only in the mean temperature growth, but in the increase of these extreme events, for instance, heat waves, which are presented here in this screen. So generally, how does the climate work that it makes this, increase of the temperature and the extreme events and such a variable situation that is far from a kind of, linear or what could we expect that a small growth of the temperature creates, small growth of extreme events or so. The story is the following, that climate system is pretty complicated, like a human body, and there are some forcings acting on the climate system. which come from outside, like we can have forcings on a human body, and we have responses of the climate system, which depend on these forcings and how this climate system or our body is built and how it reacts to forcings. So what are the forcings for the climate systems? For instance, the variable fluctuation of the solar energy, or orbital forcings, which make, different position of the Earth in space, which influences the amount of solar radiation coming. We have also some forcings from outside the climate system, like volcano eruptions, which can emit, greenhouse gases, but can emit also aerosols, which reflect solar radiations. And we have also a forcings by the mechanism which has never been observed or occurred in the natural history of the Earth, just burning of fossil fuels, just a part of coal, of carbon, which was deposited by millions of years in sedimentary rocks. So we have this forcings, and then the climate system has some feedbacks on these forcings. What are the feedbacks? For instance, in the warmer climate, there is more water vapor in the atmosphere, since the ocean covers 3/4 of the Earth, and when the air is warmer, more water vapor can exist in the atmosphere without condensation and falling down as rain. Or in a warmer climate, we have smaller polar caps, which reflect the solar radiation. So smaller polar caps make more absorption of solar radiation in the climate system. So this is how the climate system works. We exert, or something like exerts forcings, and then there are feedbacks, which are the effects of the forcings, which lead to the next climate changes. So here, this is pretty complicated fact, but I would like to show you just a plot, but I would like to show you just a very simple thing. The forcings which created ice ages, you can see on the upper panel of the plot, and which created fluctuations of the planet of the Earth of about 5 degrees, was just this tiny line here. This magenta, these were orbital forcings. But feedbacks in the climate system, which were effects of these forcings, created these critical variations of the climate from the ice age to interglacial. So if we go to, for instance, greenhouse gases, the changes of the greenhouse gases during these ice ages in the atmosphere were due to the dissolving greenhouse gases in the ocean, which became warmer or colder. And it was just a feedback due to this orbital forcing. But now we turned very strong forcing on a climate system, which has never been observed in the history of the Earth, by this anthropogenic emission of greenhouse gases. So now we became the strongest player in the climate system, in the sense that we exert much more forcing than any natural existing processes do. So what is the effect of these forcings? Remember that these effects are delayed due to the fact that the climate system has some time constant. It does not answer immediately to the forcing. So you can see here in the upper plot on the left-hand side, the changes of the global temperature from the maximum of the last glacial maximum till, let us say, early human civilization development, and response from the orbital forcings, which was leading our planet towards the next glacial age. And suddenly something happened which increased the temperature, and which might happen in the future, as you can see in the climate simulations, when with these forcings and feedbacks represented by physical processes, and try to understand how it works. So you can see that making climate forcing, you know, business as usual, we can let the Earth system to change the temperature within, let us say, 200 years to the level much greater than the difference between the ice age and interglacial period. And of course, all the elements of the climate system and of the Earth system are not prepared for such a fast effects and changes. From the geological perspective, it's almost as fast as the asteroid, you know, going and crashing the Earth system. So generally, if we change the temperature very quickly, it's a very big chance that many Earth systems which serve as, you know, so-called ecological services, like, for instance, food production or whatever, can you know, be smashed due to this rapid increase of the temperature. So there, you know, some kind of critical points in the climate system, like, for instance, in the human body. And if the temperature increases beyond this critical point, or any kind of climate interaction goes to the different stage, then the body responses coming into the very different state. So it's the same as with the Earth. So what we are afraid that due to forcings by greenhouse gases, we can cross a so-called, you know, planetary boundary, which will change our climate system relatively quickly in geological time into very different Earth, which is inhabitable by a big amount of maybe not organisms, but ecosystems which were developed. So this is why we need to stop the emissions of greenhouse gases very quickly. And of course, the story is the following, that you are working on health problem in a very quickly changing world. And even if we stop the emissions, due to this inertia, the world will not answer very quickly. But generally, our goal is, you know, to there are emissions of carbon dioxide per year, and to be pretty sure that we will not reach this critical point, we have to very quickly reduce our greenhouse gas emissions, net emissions, to zero, and even suck the carbon dioxide and other greenhouse gases from the atmosphere. So this is our first responsibility to do it. And the second responsibility, which is along your physicians, you know, activities, is to keep us relatively healthy in these conditions. So generally, the story is the following: that I have a Polish quote, but the quote you can find in this paper, which was published when I was born, by Roger Revels and Hans Suess, who just explained very well this carbon effects of emission, and proved that this is anthropogenic, that the mankind started the only in natural history geophysical experiment which has never been which cannot be repeated in the future. Within few centuries, we are giving back to the atmosphere and the ocean carbon in the carbon dioxide, which was removed from the systems from 30 millions of years. And the first question we have to answer now, can we reach the control over this experiment back? And if we can, then we can react and to survive the experiment. Thank you very much.
Thank you very much, Professor Malinowski, for this crash course and showing us the mechanisms of climate change. I have an echo now. I hope no, it's better. And I think it's one thing. Or when you were presenting, I was thinking about it's one thing to read about these developments, but then I found the visual really striking, where you showed the curve with the temperature increase, especially if you look at then how it accelerates between 2000 and 2015. And again, I think we will have lots of points to talk about from your presentation. Thank you very much. I don't see any further or any questions. So you're all in listening mode. That's good. We will continue with our presentations and we have time for a discussion at the end. So I would now like to welcome our next presenter, which is Dr. Dorota Jarosińska. She's Program Manager, Living and Working Environment at the WHO Center for Health and Environment in Bonn. And Dorota, you will present to us WHO's work on climate change and health. Warm welcome to you.
Hello, thank you, Anne. I hope that you can all hear me.
We can hear you.
Lovely. Thanks a lot.
Will you leave your video off, or will you turn it on, or what's better for you?
Okay, maybe I will keep it off for the speaking and then keep it on when we discuss. Okay.
For the discussion, sounds good.
Yeah,
thank you.
Great. So once again, thanks a lot for this kind invitation and welcome to everyone. I would like to share what WHO and the public health dimension of the work on climate change and health. A very brief introduction. I come from the European Office of WHO and specifically from the European Center for Environment and Health. We are located in Bonn, and the regional office is serving the population of 53 member states in Europe. And we are a unit working on different aspects of environment and health and providing advice and guidance. We work through consolidating scientific evidence, for example, through developing guidelines, but also developing different methods and tools to empower public health and also environmental experts to bring these health arguments forward, working with experts in member states and also working to support and strengthen capacities in member states of the region where needed. And even though for us the prime counterpart is the health sector, by the very nature of working on environment and health, we are also engaged and facilitating intersectorial cooperation and also working with stakeholders. And last but not least, contributing to many advocacy actions. When we talk climate change and health, our work is guided and framed by some global and regional policy frameworks. And I will mention just two and would like to remind ourselves that these are the documents agreed also by member states, by countries, by ministers of health. So last year, a global strategy on health, environment and climate change was presented. And this sets out a 10 years long plan of action to improve, to create conditions for better and more equitable health through targeting environmental determinants and through tackling climate change, both from the adaptation and mitigation perspective from the health sector. And in Europe, we have now for long established regional platform for working together by the health sector and environmental sector called European Environment and Health Process. And in fact, since the very beginning, from the first ministerial conference that took place in Frankfurt in 1989, climate change was already signaled as a public health issue. And then in the following ministerial conferences and through the years, different aspects were discussed. For example, after this prominent heat wave in August 2003 at the ministerial conference in Budapest, the focus was on dealing with extreme weather events. Later on, as the interest grew also in our member state, there was a discussion how to organize it, and in Parma, a dedicated group was created on health and climate change, and the group is meeting regularly to discuss priorities, needs, etc. The most recent conference on environment and health took place in 2017, and these are the priorities identified by the countries on environment and health agenda, and strengthening both adaptation and mitigation dimension of climate change is one of them, but also efforts to improve air quality, to facilitate more sustainable development of urban environment are directly relevant, as well as a new concept of building environmental sustainability of health systems. So reducing environmental pressures related with the functioning of health systems, but also strengthening their climate resilience. Climate change is a health issue. It is, I'm sure, apparent in this community, and we have heard it from Nick. And in fact, early this year, WHO looked into the urgent health challenges for the upcoming decade, looking at the time frame also of Sustainable Development Agenda. And of course, health in the context of climate change is one of those urgent health challenges. And in fact, the statement is the formulation is very clear. Climate crisis is a health crisis. And there are many ways how phenomena related to climate change can affect human health. And the point is that we, of course, do not have any climate change specific health impacts, but many of those that are related to either direct impacts of extreme weather events or indirect impacts through deteriorating quality of water, air quality, or through ecosystem change, they all contribute and add to the burden of disease which already is affecting health of people across the globe. So including cardiovascular disease, respiratory, of course, injuries and fatalities, communicable diseases, but also mental health. But when we think about the relationship between climate change and climate variability and health, these are not only these environmental phenomena, be it extreme weather events or environment of deteriorating quality, but there is of course also the social context, the social dynamics, the condition of the societies that are being affected, and this all affects the magnitude and the burden borne due to climate change related this. This also is reflected or requires very comprehensive action if we think of responses. So we require both now mitigation and adaptation, and the health sector also needs to be part of the mitigation efforts, but a large component of adaptation measures through environmental regulations, strengthening social resilience, but also resilience of the health system and special activities within the public health system adaptation, from strengthening primary health care, development and maintenance of warning systems, but also developing timely of action plans, preparedness, and then also response systems. So this is quite a task. We already have heard that climate change is affecting our health now, and indeed the simplest and at the same time very dramatic answer to the question who is at risk of climate change is indeed everyone and everywhere. Of course, the magnitude, the intensity may differ, and there are people, groups of people who are particularly vulnerable, be it because of the age, health condition, but also certain groups of people involved in certain occupations, for example, outdoor workers, but also people who work indoors. If we look at the current situation with COVID, where there was this very abrupt change of the mode of working with lots of teleworking, and then for sure in the context of events like heat waves, the conditions would not always be optimal. If we think, for example, of health workers, also this dimension of heat stress would be adding to the many burdens that this group of professionals is bearing. There is also certain variability when it comes to locations that are more vulnerable. These are those parts of the world which are where these climate changes are more prominent, like in the Arctic, polar regions, in some mountainous areas, but also from the public health perspective, those countries or regions where health systems are weaker and not always ready to respond. We also have already heard that this is not a remote, a future challenge, but this is also the problem that affects us here in Europe. And with this map, I just would like to stress this overlay of certain features of vulnerability to climate change related to the distribution of certain events like droughts and heat waves affecting mainly Southern Europe, but very rapid and intense precipitations more strongly affecting Central and Eastern Europe, or coastal flooding affecting parts of the Northern Europe. These are the projections. But from the public health perspective, what also matters is the health condition of people living in those areas, as they also affect the magnitude and the intensity of the health impacts that the health systems will also need to cope with. There are several, you will come across different numbers, estimates of the health impacts of different episodes, of different specific events related to climate change. We are short of any robust assessments. This is just an example based on the information from the European Environment Agency, based on the insurance companies' data, just to give a sense that between 1980 and 2018, in the EU countries alone, there were around 90,000 of climate and weather-related fatalities, and also a huge economic burden related to this. In the recent opinion of the scientific body of the European Commission on the health in climate change adaptation, we read the figure of the average number of 2,700 deaths due to heat waves annually in Europe, and projections that these numbers may go as high as 30 to 50,000 per year if no adaptation and no measures are taken. So it is more to give a sense of the magnitude of certain specific health situations. What can be done? Of course, these are big systemic changes that need to affect a number of sectors and systems: transport, energy, food systems. Most of them are, of course, most of these measures are outside of the health sector. So they are all impacting, they are all relevant for our health. However, they are beyond control of the health sector. So what we can do to support the health consideration and health work in the climate change? During the COP24 in Katowice, it was for the first time that health and climate change report was presented, which for the first time in this context provided kind of a synthesis of the knowledge on these connections between climate change and health, gave an overview of initiatives and tools, and also formulated a number of recommendations and hints for the UNFCCC negotiators how to maximize the health benefits, how to strengthen the health argument. At the same event, the two documents, two pieces of WHO work were presented. They are illustrating our work related to health in the context of climate change mitigation and adaptation. We have already heard in the first presentation these signals in information related to improvement of air quality. These signals relevant also from the climate change perspective, and indeed from the WHO perspective, working on the synergies and bringing these agendas of reducing air pollution and protecting health also in the context of climate change, they feature very prominently. While in general, air quality, air pollution, and climate change, it's quite a complex relationship. There are benefits of targeting both, since the same sectors that emit pollutants which can directly affect human health, they also play a role in the climate change, thus targeting reductions in the sectors like transport, energy, but also agriculture. They can deliver benefits to human health. The way how we try to empower experts in the public health, but also in environment, is to develop tools and methods that would allow them to quantify the health impacts of actions taken. And the tool that was launched at the COP24 in Katowice, it's Carbon Age, so carbon reduction benefits on human health. And this is a software that allows to calculate health and economic effects of improvements in air quality, which are related to the reduction in the emission of greenhouse gases as defined in these nationally determined contributions. So bringing the agenda of greenhouse gas emissions reductions, air pollution reductions, translating it into the health and economic figures. Another tool, very widely used, and we are really very proud of this, is a tool that allows to quantify the health impacts of air pollution, and also to build different scenarios. What happens if we improve air quality, if we reduce air pollution? And also a tool that allows to quantify the health and economic impacts of non-motorized transportations. So this is a tool for the health and economic assessment of walking and cycling, including also the component of air pollution and carbon impact assessments. So this is how this message about the health aspects of climate change in connection to air quality, also in linking with reduction in air pollution, can be translated into certain numbers and can reinforce the health argument when entering discussions with other sectors, when planning policies and actions and measures at a different level. Moving now to the adaptation component, I just would like to mention the recent major work of our office, which was an assessment of the progress made in addressing health aspects in the climate change adaptation policies in the European Union. In this study, 20 EU member countries were included, Poland also. And this assessment included also a compendium of good practices in addressing the public health dimension of climate change adaptation. This was also presented in COP in Katowice, and this is also part of the work relevant for this now ongoing process in the European Union of preparations to the new EU climate change adaptation strategy. So just a very quick overview. What was the situation noted at the end of 2018? So the countries that took part in this were covered by this assessment. All of them reported having a well-established governance mechanisms. Most of them were also reporting, conducting assessments of the health vulnerability and also impact assessments. Also reported were efforts on strengthening public health capacities and health systems, while the level of awareness of the relevance of health effects of climate change and the relevance of climate change mitigation adaptation measures was reported in fewer countries, as well as a bit less was reported on the existence of the approved national climate change health adaptation policies. There is a number of specific conclusions. What I would like to stress is this aspect of acknowledging the responsibility of the health sector for protecting health from the climate change, but of course the critical role of working with other sectors and bringing this health into all sectorial policies relevant for the climate change adaptation, and bringing the population health into account in all plans and activities to build resilience and to adapt to climate change at different levels. And to do so, it's critically important that capacities in the health sector are built, that health professionals, they have the tools, that they have the knowledge, that they can also be these, what you can call agents of change, that they can really bring this health argument when discussing with partners from different sectors where the actual changes are happening. In the Polish title of today's webinar, this is Krajobraz w czasie pandemii, so it's the COVID-19 landscape. So to finish, I just would like to give two examples of activities, how this COVID-19 context was considered. One, when it comes to the timely issue for the summer of providing heat-related advice, how to protect health during heat waves. The activity, which is not new and which was undertaken also in the past. However, for different reasons, there was a specific context for 2020 given the COVID-19 pandemics. So this I would like to show as an example of, I would say, mutually reinforcing messages that because of the COVID-19, there was an interest in getting this type of information, so we could serve two purposes and put the information and advice how to protect yourself from heat also in the context of COVID and special conditions and circumstances that many people in Europe have had to experience in this period. The other thing more directly linked to this climate change, air pollution agenda, of course, is the issue of air quality. And I'm sure that you have all seen these signals and media messages of these changes in air quality triggered by the lockdown situation. And while, of course, the context is dramatic, the signal is very strong of this short-term change resulting in the change in air quality, mostly visible for transport-related nitrogen dioxide. These and other aspects of the COVID-19 situation are also triggering thoughts and plans what to do next, how to recover better from COVID-19. And here I would like to mention that the WHO published this manifesto on building back better, which is very much about looking into these upstream determinants, reinforcing the relevance of nature, so functioning ecosystems providing all the services, focus on strengthening health system, including the environmental dimension, much emphasis of moving to cleaner energy, to switching to sustainable food systems and diets, of course, focus on the urban environment, as well as a plea to move away from these toxic subsidies and redirecting the financial streams. And in this manifesto, some of specific ambitions relate to climate change, again, both into the contribution to mitigation of greenhouse gas emissions and also to adaptation measures and strengthening resilience of the communities and of the health systems, and relevant and linked specific deliverables and related to reducing air pollution through multi-sectorial policies, policies that would facilitate implementation of sustainable and clean fuels, and enforcing air quality standards that would be protective to human health in line with the WHO air quality guidelines. So with this, I would like to thank for your attention. Dziękuję bardzo za uwagę.
Thank you very much, Dorota. Big thanks for taking us on this tour on the health commitments, on WHO's work, and on showing us all the many, the rich materials that are available for people for further information. And as I mentioned before, we will be sharing some links with participants after this webinar, and I can recommend especially looking into the tools that you presented, as they can be very useful for policy discussions that are happening, be it at local, at national, or at European level, in terms of especially exchanging with people from the economic and finance side. And we will be getting, of course, back to COVID considerations as part of the discussion. I'll move to our next speaker, Dr. Aleksandra Kardaś. Warm welcome to you. Dr. Kardaś is an atmosphere physicist and a popularizer of science, as well as the author of Book on Water. She's a co-author of a website that's called Nauka o Klimacie. Hope my pronunciation was okay here. And also, you're also co-author of a textbook of the same title. For many years, you've been sharing your knowledge about the climate and phenomena occurring in the atmosphere with the audience during lectures, science festivals, and online courses. So you have a rich expertise in actually communicating and raising awareness on climate change. And you will now be speaking to us about the change in living conditions in Poland. The floor is yours.
Tak jest, bardzo mi miło.
Yes, it really is a pleasure for me. And we've been talking quite much today about climate change, about health in the world. And now I would like to deal with those effects of climate change, which are more important for people who live in Poland. First of all, when we talk about the climate change, we talk about the fact that the average temperature of Earth's surface goes up. For example, here we can see the rise of the average temperature of the surface in general, then the global change of temperature. We can see the temperature has gone up by 1 degree roughly. We can have a similar graph for Poland, and we can see how the average temperature in Poland was growing up. And we can see here the temperature in specific years, and the red line is the flattened graph. And we can see also that the mean temperature for Poland has gone up even more than the global mean temperature, and in our case it has gone up by about 2 degrees. However, the rise of a mean temperature may have an impact on the weather, as people think, but that impact is not really reduced to the fact that every day in a year is a little bit warmer, and the dynamics of the temperature change all over the year is exactly the same. It is a little different. And here you can see the graph that you could already see in the presentation of Professor Szymon Malinowski. This presentation can show to us the distribution of the occurrence of different thermal conditions. The blue part of the graph shows to us the conditions which are colder than the mean, gray close to the mean value, and the orange conditions warmer than the mean value. For every day of the year, or every month of the year, we can prepare such statistics and identify whether individual days or months are warmer, colder, or close to the mean. And here you can see the graph for the period of 1951 and 1980. And this is another graph, and this graph is also well known to you, and this is the graph for the period 2005-2015. What do we see here? We can see that the distribution of the probability has shifted towards higher temperatures, and it means that we have more warmer days, more very warm days. Days sometimes are warmer than they have ever been, and there is a lower number of cold days. However, this distribution is flattened, and it is not really the case that there are no cold days anymore. It is sometimes mistaking, it is deceiving for the public. Many people believe that a few cold days mean that there is no global warming anymore. But when you look at the character of these changes, you can see that even if the global warming is happening, when there are the higher temperatures coming up, cold days can still occur. Amongst others, thanks to the fact that those days may sometimes be even colder than they have ever been before. Perhaps you do not need any additional explanations of what the distribution is, what the statistics is, that sometimes some days are warmer than ever or colder than ever. But my explanation, which may be useful for you when you try to explain it to someone else, how one should understand this change of a mean temperature and what it translates into. Instead of that graph, we can imagine a hat where we different lottery tickets which correspond to different weather conditions. We put there the same number of lottery tickets which correspond to the cold weather, average weather, and warm weather. And those are our baseline conditions. So this is the baseline situation. When we draw something from that hat every day, can turn out to be colder than the mean, warmer than the mean, or the mean with the same probability. And what is caused by the climate change? The climate change leads to the point that this, drawing is falsified. And we draw from there some of the tickets that correspond to the cold days, some of the tickets that correspond to the, moderate, normal days. And we add the more tickets that say that today is going to be warmer than ever or warmer than usually. Well, it is changing. That is why our drawing is falsified, and there is a much higher probability that every individual day throughout the year will turn out to be warmer than ever. And it is also possible to add some of the days which are as hot as they have never happened. And we can see that there are more warm, very warm days, and there are more and more frequent. And sometimes the conditions unknown to us come up. And that is why we go back now to Poland. A standard threshold, psychological threshold for the temperature in Poland is still the temperature of plus 30 degrees. It is above 30 degrees, people believe that it is really hot. When I was a little girl, I believed that when it was warmer than 30, it was close to death. This is how we understood. Today, we know it is not really true. We know that such temperatures can persist for over 1 month and we still are alive. But it does not mean that all of us are safe. You can look here at a map which is based on a data coming from the Institute of Meteorology and Water Economy for the period 1951-1980. And we can see here the number of days with the maximum temperature above 30 degrees. We see then that on average, before 1980, there were 3 full days with that temperature. At the seaside, fewer. And in the central part of Poland, more days with such temperature. But, these were just single days over 1 year. And now look at the situation from the period 2010-2019. And now you can see that the number of days with the temperature is going above 30 degrees is on average more than 11 over 1 year. And that means that there are 3-4 times more such days. At the seaside, there are about 6 days like that. In the center of Poland, over a dozen. And that means that there is a fundamental change of what our summer looks like, and summer in a city. The conditions we have to handle somehow. This temperature used to be exceptional in the past. Today, it becomes a new normal. But as you know, it does not mean that our organisms are properly accommodated to face the situation. The number of very hot days is going to go up in Poland over 1 year. This is a graph that depicts first the observation between the 60s of the 20th century up to date. And this is observation from Warsaw, from the meteo station, the weather station at Okęcie in Warsaw. And now this is the projection. This is what we forecast in the future, the red line for the same location. And you can see that the 21st century, the number of very hot days is going to approach 20 over 1 year. And finally, at the end of the 21st century, if we do not really hold the carbon emissions, it can go up to as many as 50. All our summer, which is July and August, or June, July and August, will be at risk of having most days with the temperatures over 30. In Warsaw, we know that Warsaw is in the center of the region, which in Poland is at the highest risk of a very hot days. But in other regions of Poland, this rise is also going to be noticeable. When we sum up the subject of waves and heat waves, we can see that the heat waves in Europe are twice as long as they were 100 years ago. And it certainly means a much greater risk for the citizens of Europe. We talked about it in previous presentations. Moreover, temperatures do not drop significantly at nights, and more frequently, these are tropical nights that we are experiencing. The nights when the temperature does not go below 20 degrees Celsius. Such nights in Warsaw prior to 1990 happened once in 10 years, once in a decade. At the turn of the 20th and 21st century, every 4 years we had tropical nights. Now, every year, sometimes every 2 years, we experience tropical nights in Warsaw. And it makes our life much more difficult because neither the infrastructure has time to cool down when the temperature is so high over the night, nor people have the possibility to rest from the heat and have valuable nighttime rest, which would allow them to live normally the following day. It is a greater and greater burden for us, and it means that we really have to take this threat into consideration. It is not something which is far-fetched. It is a problem today and here. As you know, I am sure, those exceptional heat waves are especially dangerous for elderly citizens, and they are especially dangerous when they are accompanied by high humidity. Fortunately, we do not live at very warm sea bay in the south. That is why it doesn't really happen very frequently that so dangerous conditions for human life occur. Those are still just single days over 1 year, but we expect that if the greenhouse emissions are not reduced significantly, the number of such days over 1 year will go up several times. And we have to realize what it means. What it means that we experience such a heat wave which is dangerous for human life. It doesn't really have to be the temperature above 30 degrees, because we know that if people are more vulnerable, if people are not really very well accommodated, even if the temperature is a little lower, but in a prolonged period of time, it is a problem. We also have to realize that every wave of heat which is bordering on the temperature ranges which are dangerous to human life, it constitutes a risk for human life and health. Even if it is 5 days a year, it is still 5 days. And over these 5 days, some of us will not be able to survive. They will not be really interested in what is coming next. They will not be interested in the fact that these are only 5 days because they will not be able to survive the first or the second day. That is why we have to realize that mean values translate on specific heat waves and specific hot days. And if the frequency of those days goes up, even insignificantly, it constitutes a risk for human life of many individuals. Next to temperature, there are also other conditions that are prone to change in Poland. The weather in Europe largely depends on the phenomenon which is called the stream current. This is the wind that is blowing in the upper layers of the atmosphere. Those colors this is the wind of a high velocity. The natural, the red color, the more red, the higher the speed of wind. This is the current I'm talking about. When this current goes fast, smoothly, horizontally in the upper layers of the atmosphere, it pushes fresh masses of the air from above the Atlantic Ocean over Europe. When is it happening? When is this current fast, when it is so vigorous, and when it is ordered in this way? When we see significant temperature differences between the poles, these areas. So when there is really cold and a lot of ice in the north, and the situation is less and less frequent. That is why when the temperature in Arctic is very low, this current is fast, and in Europe, temperature changes very fast. So we have regular airing, frequent changes of weather, as well as but when we have the situation is like now, when the Arctic is really changing, the difference of temperatures between the Arctic and the tropics is different. Then the current is slowing down. And just as the river, when the river goes to the flat area and is starting to go slowly, that current, when it is also slower, it starts meandering, it starts halting, and then instead of regular weather changes, we are having to do with the blockages and the long persistence of the unchanged weather in Europe. It is one of the causes, it is one of the practical causes for which in Europe we observe those heat waves. When we have this blockage of storm and when there is no fresh air allowed from above the ocean, there can also be very hot air coming from above the southern part of Europe or the tropical areas or from the interior of the continent. It is very hot weather, but unfortunately it is also quite dangerous. The other circumstance where the frequent high pressure blockages occurrence is the quality of air. Because when we have a long blockage of the high pressure and rare changes in the air, no airing, but we have the stoppage of different pollutions at the surface of the earth. I think that after a few years of the smog education, you can also identify those words like the inversion of temperature or the high pressure. When we have the storm center somewhere and the extended persistence of the high pressure area over Poland, then we are having to do with the temperature inversion occurrence. And it is also the time of the descending movement of the air. The high pressure area is the area where the air goes down to the center, and then it compresses in the atmosphere, and in that place of the atmosphere a warmer area is generated, and this is the area of temperature inversion. Because we are having to do with the inversion. The regular situation is that the higher in the atmosphere, the colder it is, and here when we have this warmer area, the situation is totally reversed. The higher in the atmosphere, the warmer it is. That is why we have this word inversion to describe it. This inversion is also the area which makes it impossible for the widespreading of pollutions. If there is even some air movement that would take the pollution from above the urban area, it is stopped there, and it's not air, it does not distribute all over the atmosphere. This is the situation of us being suffocated by the movement. It is the descending movement, and the ascending movement is blocked. That is why the pollutions can remain in a specific location. They don't go up. That is why we observe the worsening of the quality of air. It is one of the reasons for which the climate change in Poland, unfortunately, means the worsening of the quality of air in Poland. It is just one of the reasons. The other reason is that the change of climate means a higher probability of fires. It is seasonal, and it worsens the quality of air. In summer, it contributes, the sunny days, heat, contribute to the photochemical smog. And this is the generation of ozone in the layer close to the ground in towns. And additionally, we have another problem connected with the shifting of the periods of the pollination of plants. Those plants which used to pollinate consecutively, now they can pollinate simultaneously. It can shorten the period of 1 year when they bloom, but it definitely worsens the quality of air on the days when everything blooms and pollinates at the same time. This is an example I wanted to show to you. It is not about plants that are typical for towns, and I took it from the presentation of Bogdan Jaroszewicz from the Department of Biology of Warsaw University, and it shows the first day of the blooming of the plants from the lowest layers of the vegetation in forests, and on top it is for one specific species, and on the bottom for 6 species together. And this is the day of the calendar year when they bloom. You can see that as the time goes by, their blooming takes place earlier, and those are plants which bloom, and it means that they also pollinate earlier. We also have to remember that it is not necessarily synchronous, because different plants have different life cycles and they react to different conditions. That is why it is possible to overlap for different periods of blooming of different plants to overlap, and they didn't overlap in the past, because one plant reacts whether it is warm enough to start blooming, and the other one whether or not there is enough light to start blooming. So there may be some shifting and the overlapping of the pollinating periods of different plants. Moreover, there is another phenomena that we have to note, that there are fewer and fewer freezing days over 1 year. The changes are quite significant, and those are the days when the temperature goes below 0 during the day. First, there is the observation and then the projection of climate, and this is for Poland. So you can see that still in the 20th century, we had over 100 days with the temperatures below 0 over 1 year. The whole winter was icy. Now it is not the whole winter, because now we have 10 or 20 days like that, fewer over 1 year. So 1 month less. And we expect that depending on the different scenarios, more or less pessimistic scenarios, the number of days where the below 0 temperatures can go down to 30 or 60. So those are the ranges over 1 year. From a 3 solid or 3.5 solid winter months, we will have 1 month or 2 months. And this is also a problem because of different factors connected with diseases, pathogens. One of the most popular source of infections are ticks in Poland. And ticks, because of the climate change, they start widespreading in Europe. It is not that obvious, because climate warming is good for them, but they also need humidity. It is becoming drier, so it's not that obvious for them to breed and widespread, but for now we see that their range, as well as the altitude where they can be observed, unfortunately grows. The percentage of ticks infected with Lyme disease also goes up, and this is a graph that shows the percentage of, or the number of infected people with Lyme disease, and it is going up, and it is in the period between 1998 until the beginning of 2018. The number of cases of diagnosed Lyme disease goes up. It is connected with the fact that there are more ticks. Ticks are active over a growing number of days over 1 year. They are more infected, and it is easier for the Lyme disease pathogen to persist in higher temperatures. And that is why the infection is simply more possible. Another disease which is very dangerous is the tick-related encephalitis, but we have a vaccination, so we do not see a skyrocketing trend in terms of the incidence of the encephalitis. It is simply caused by the fact that people can be protected. People who, for professional reasons, are exposed, they get vaccinated. But we have to remember that it is the disease, or these diseases, both of them, have to be remembered today, because the infection with those diseases is more and more possible or probable in Poland. Some other problems that we can observe, and it comes up in different vacation information. It is the flora in the Baltic Sea. The average temperature is growing is the number of days with the temperature above 17 degrees up. It is twice as frequent than earlier, and now cyanobacteria is more and more frequent, and it is really more and more frequent, and high temperatures really are very conducive for their breeding. The green algae is really more and more prevalent, and more frequently we will see this as in this satellite picture, where we can see those beautiful compositions, and it means that we have the green algae present everywhere. So we can help to fight this problem, not only by means of lowering the temperatures, but also by caring that the Baltic Sea is not polluted with fertilizers. Perhaps this is an adaptation option. Moreover, there are conditions for other pathogenic bacteria present in the Baltic Sea. This is another example of a graph from the last year's report of Lancet Countdown, and it shows the changes in the occurrence of the conditions for the epidemics caused by Vibrio species in the result of the changes of salination and water temperature in the Baltic Sea. Since the 80s, the area of the Baltic Sea, which is good for those pathogens, has gone up by 30%, and the number of days when they are active because of the temperatures and salination has gone up twice. That is why I think it's worthwhile looking at what is happening in the Baltic Sea. I think that
Dr. Kardaś, I'm really sorry, but I'm going to ask you to wrap up because we're running out of time and we have one more speaker. Yes. Thank you.
All right, this is my last slide. So
okay,
thank you very
good.
much. It is excellent. So thank you very much for your attention.
Wonderful. Thank you very much for your presentation and on giving us all of this data on the situation in Poland in terms of the rise in heat waves. And I certainly have a question on that, but I'm going to hold that because indeed we do have one last speaker, which I'm very pleased to introduce now, which is Dr. Kamil Wyszkowski. He's president of the management board of the UN Global Compact Network, Poland. And the Global Compact Network is a voluntary initiative based on CEO commitments to implement universal sustainability principles and to take steps to support UN goals. And Dr. Wyszkowski, you will talk to us about the climate crisis, the UN climate policy, and the European Green Deal. So giving us this outline of what needs to happen now. We've heard a lot about the data in the past presentations, and now we'll hear some more on which steps do we need to see policy-wise. Thank you.
Okay, thank you very much for this brief introduction. If I didn't understand, I can switch into Polish. So let me do that. I będę kontynuował po polsku.
All right, so I'm going to continue in Polish. It is true that for the last 18 years, I have been working in this organization. Currently, it is the United Nations Global Compact lead. And we have been celebrating the 20th century of the part that has been cooperating with the private sector and the government and is developing different solutions to different problems, including the problem of the climate crisis. I would like to ask you to start my presentation. All right, thank you very much, Jacek, for starting my presentation. I'm going to speak and we are going to listen to the presentation or watch the presentation at the same time. Let me start with the following. I'm going to talk about individual slides, and I would like to focus on the climate process. On the basis of the slides that I am showing to you, I would like to show the picture that was taken by NASA under the NASA observatory. Energy on Earth is taken from the fossil fuels, but it is also ridiculously cheap. And this is the so-called pollution by the light. We can see this from the orbit. In the subsequent slides, you can see it even better. It is again a picture taken from NASA, and you can see on the one hand where the light is generated, where electricity is generated, and on the other hand, how we are distributed all over the world. Those models are stable for a really long time. Since that time, those cities which are effectively located in the places where they are doing quite well. Most of them have survived up to date. The settlement network is developing now, as you can see in the picture. We people live on Earth not evenly. It's also worthwhile realizing that the cities take about 3% of our surface. It is also important from our perspective that the cities absorb a lot of energy. From 60 to 80% of energy is absorbed by cities. In the next slide, and now I would like to move on to the next thing, which is the climate process. This is what Professor Malinowski said when he had his presentation, and this is really something concerning for us. In general, the discussion about some things happening to climate, it is nothing new, and it is not really very fashionable now. Everything started in 1990. It was an article from the Times. A colleague from WHO, whom I would like to greet very warmly, mentioned some WHO documents from the early 80s. And I would like to remember that the first analysis of WHO on the impact on climate, it was the famous meeting of G7 meetings in Tokyo. It was 1997. At that time, people talked mainly about the Transborder Convention on Clean Air. We know that this is something WHO has been dealing with, but the conclusion of the summit was that the temperatures should go down, but they go up, and something is wrong. It was 1979, ladies and gentlemen. It was a long process of reaching what we call the climate summits or other climate action activities. That event, the UN Climate Action Summit, took place in September 2019. Antonio Guterres, Secretary General, decided to organize it not just in December, but also during the General Assembly of the United Nations in September, when all heads of state and government are in that room of the General Assembly of the United Nations to talk about the climate action. In the subsequent slide, you will be able to look at the COPs, what they look like. We have been looking forward to COP26, which is going to take place in the UK. It was postponed. It is not going to be this year, but it is going to be in November 2021. It is going to be merge the British and Italian presidencies, but the summit that was organized in Poland, COP24, it was the time when we talked about the Katowice framework. We are referring to the international Paris Accords that agreed on the targets for the world not to go up with emissions, not to allow for the increase of temperatures, but it is not really happening. And the most recent COP that took place in Madrid, it should have been in Chile, but we know that there were different social turmoil, and that is why the Madrid COP finished, and it was not possible to develop the executive documents to Paris documents and the Katowice roadmap. Everyone has been looking forward to the meeting in the United Kingdom to do something about it. In the subsequent slide, you will see how it is illustrated. You can see the climate process here. Those are different sectoral meetings that are organized by different agencies, and they develop their reports. A few months ago, I was asked to prepare a list of reports which were developed in 2019 about climate on the basis of the UN reports. Obviously, no one reads it. They contain, statistical information, but all these reports say one thing which was mentioned by other people who took floor during our today's meeting. Well, we have the scientific consensus concerning the 21st century, what is happening. In the subsequent slide, you can see COP26. It's going to be postponed by 1 year, but the works are underway. And you can find there all the information about the conferences that prepare us to COP26. It's worthwhile reading this more thoroughly. This slide can illustrate what I think all of you realize. This is the idea of sustainable development. These are human settlements. And when we look at the different cities, and if we realize that the cities consume 60 to 80% of energy coming from fossil fuels, unfortunately, well, at least most of it comes from fossil fuels, and we have no alternative to them for the time being. Then we can see that those are the areas where we have the concentrated problems. If we start dealing with towns, we will be able to see the fastest outcome for the quality of life of people and for our health. Why is it that important? I will try to tell you now why it is important, telling to you about goal 7 of clean energy. I'm not going to talk about the details, but I would like to tell you also that energy is produced on the basis of coal, oil, and gas in about 70% all over the world, not only in Poland, but you know, coal, we have energy which is coal-based. If we move on to target 7, which is going to the renewable energies, and if we were to finance it, we would really need huge investment until 2030. This calculation is really very well prepared. 6 development banks and UNDC prepared together with the Bank of Reconstruction and Development, regional banks, the European Central Bank, and other banks. It's really a great development, and it shows that we simply do not have enough money to allow for this to happen. Next slide. Here you can see this is another goal number 11, and we really have to realize that there are other problems connected with cities. We also have different cities. For example, we have 30 million people in one place, very well managed, but we also have other cities, like for example New Delhi, and those cities are really very badly managed. And all other cities which are connected with the management. It is connected with rivers full of unpolluted waters and the buildings that do not fulfill energy norms. And this is about FDG 13, and this is devoted fully to the next phenomena. It is not really moving on very well. We are losing it. Here, when you look at the climate action, we have the European edition. And in Europe, well, it is going to be here. You can see here the spendings in Europe. Europe is rich enough that it is able to afford it. Those green deals are also from the Asian perspective and Austrian perspective.
Which is relatively interesting because, for instance, you have a prime minister of a country supporting coal rather than renewable energy sources. We have the American context also. On the next slide, you see the consequences of a conversation about climate change in the context of culture. This is Olga Tokarczuk receiving Nobel Prize and talking about climate change. And on the next slide here, you've got ecology Nobel Prizes awarded last year, the economy of development, and 3 Nobel Prizes holders who talk about economic sciences, but in the context of environment, who tell us that we shouldn't base on GDP anymore, but rather try changing the manner of calculating these things. So really read up on their works because they say some interesting things. Another slide, my next slide is, how do I put that? Professor Malinowski will understand it best, what it's like to be a scientist who's been saying things for years and nobody listens to you. So this is the advisor, UN advisor for human rights, who was responsible for creating a report about climate change effect on human rights. And the journalist started talking about it as a report about climate apartheid. It focused on the South. It talked about the climate change causing wars and destroying our entire heritage in terms of human rights as the humanity. Let's hope he was not right, but who knows. Another slide shows various chances, opportunities. Heliogen is a revolution, potential revolution in the cement industry. It's a startup financed by Bill and Melinda Gates. The sun is used to generate very high temperatures. If current thresholds are exceeded, 1500, for instance, degrees, then cement production, steel mills can be switched over to solar energy. If that can be done, because let me remind you that steel mills are responsible for a huge amount of CO2 emission in the world. So if we manage to switch them, because let's remember, cities are built of steel, concrete, and glass. Another example is an installation now launched in Sweden as a whole, fueled by hydrogen energy, mainly water and wind energy as well. So if these experiments work, this is, for instance, Gorazde, a cement factory that can be completely revolutionized if it works. The entire production structure could be changed. In these orange tubes here, this is an installation where very high temperatures have to be achieved in order for concrete and cement to be manufactured. So this is what the game is going on about. We need resources, financial resources, to finance new developments that would allow us to escape fossil fuels burning and rather switch the production of these very important items to renewable energy sources. This is Olga Malinkiewicz, who created a completely new technology. Luckily, she was granted enough money to develop her new energy technology. I'm rooting for her receiving a Nobel Prize. This is what her invention looks like. This is a photovoltaic solution that can be used on irregular surfaces, on buildings, on glass, on cars, on pavements, anywhere. It can be placed on any irregular surface, and it can be used to generate solar energy. It is already tested in Warsaw. We are doing it in Warsaw on a building, so and the results are very promising. So this is a collaboration of business and science. This is where we can develop a new solution that is interesting to us. On the next slide, it's slightly more philosophical. We're talking about Anthropocene. This is where we are, in the middle of it, us as humans. You probably remember from biology classes, this is a 24-hour clock and geological eras. So you see how little time we needed to ruin quite a lot. The green here, this is the increase in GDP that you see, and this is, growing wonderfully. You see it everywhere here. There is a slight drop in 2020 because of COVID, but it's going to keep growing, and these are the consequences of it. There is a report that it's issued every year. I'm not going to discuss it in detail. These are the points summarizing it. Everything seems to be going very well globally. Vaccinations, perinatal care, and so on. Things are developing, the population is growing, trade is developing. The problem is that everything that we call development, costs us resources, and these resources, you know, we are losing them. Like, for instance, wetlands, we have already lost 85% of them. Deforestation, even oceans. So even fisheries, industrial fisheries, but also acidity of oceans. On the next slide, you will see that very clearly. I know that I'm in a hurry. So you see the graphs showing the consequences of human population inhabiting various areas and various species dying out because of that. On the right, you see as the situation is currently. So declines in various species survival. The cause for that is mostly, for instance, acidity of oceans, various sorts of pollution. So everything you eat or wear probably was brought to Poland on a ship, because this is how the majority of goods are transported. And maritime transportation is responsible for acidifying our oceans, and this is a huge risk for the ocean ecosystem. The next slide shows urbanization. So this is something, urban development. It's progressing very dynamically. By 2050, 66% of our population will live in the cities. And how to deal with it? We've got so many more megacities now. This is where the fight for limiting energy consumption is actually happening. This is data for Eurohabitat. In Poland, we are also analyzing these numbers. We will talk about it later, I hope. These are the consequences of the increase of temperatures. I am showing this from a report from 2007, and it's still up to date because it envisaged the migration crisis in Northern Africa, the necessity of populations moving from south to the north, and Europe was actually touched by that. There was a lot of social unrest. Then the war in Syria, in Iraq, Islamic State, and all the other misfortunes that followed and touched Europe as well. So on the next slide, you see the large green bubble. If we do not successfully face climate change, everything else is going to happen. All the bad things listed here, like water crisis and so on. On the next slide, and you see the data on the right. This is my favorite analysis prepared by 6 UN agencies, showing us how the number of migrants is going to increase because of the climate crisis. If in 2030 we assume 54 million refugees, by 2050 there's going to be 200 million and 2 billion by 2100, and this is something that we have to realize. So now switching over to the next slide, this is United in Science. Professor Malinowski already explained everything that you need to know. Ola was also talking about the same thing, and my colleague from WHO, so I wouldn't like to dwell on it, but you have the most important topics listed here, the biggest concerns like acidification of the oceans, sea levels on the rise, increase of temperatures, and dangerous weather. On the next slide, and I'm almost finishing, this is something that I want you to remember because it's a key slide that talks about SDGs and how important they are, but it's all about the money. You see banks and insurance companies. What we did last year was very important because we had a task on the basis of the Paris Agreement to lead to a bank alliance that would perform a symbolic switch of capital to walk towards low emission economy. And on that UN summit that I showed you, all the development banks, including commercial banks, decided that they will not finance high emission investments. In Poland, there is a bank. There was no bank, for instance, ready to sign up for the investment in Ostrołęka, and I think this is key. Also, the insurance lobby is supporting us very strongly. There is a council of insurance companies supporting us and saying that the sector that is most energy consuming is very difficult to insure. There are so many new phenomena, new events that make it very difficult and dangerous. So many force majeure events in action these days. On the next slide, you see how we manage all that. We see banking and financial instruments, but I wouldn't like to bore you with that. Going further on, this is key. This is the increase in population projected for the future and the consequences of that, because every next human is more consumed energy. So you've got positive and negative scenarios here. But have a look at the basis of energy consumption. If we don't get rid of the red, green, and black, it's not going to get better, because in the positive scenario, you see slight difference by 2060. So this was something that Shell, for instance, discussed. This is, it gives us some hope, I think, the slide, the orange, pink colors that you see on top of the bars, solar energy, water and wind energy, but it's still not enough. These growths, these increases are not enough because we have more and more people. And, you know, countries are still developing, and so their energy consumption is on the rise. So on this next slide, you see it very clearly. You've got expenditure on specific energy sources. I'm accelerating already. And you've got electrical sockets
could I ask you to
and
wrap
electricity
up? Thank
production.
You.
Give me 2 more minutes, okay? It will be really great. Okay.
So now you see the world electricity production, the majority of energy comes from fossil fuels. And on the next slide, you see the largest manufacturers, who produces what. And on the next, you've got energy supply and increases of energy use. You see where we are at this level of development. And this is my final slide. I will not show you anything that comes next because I don't want to be strangled by the organizers. So this slide shows you the dilemma of the climate process. Highly developed countries that are responsible for approximately 78% of the carbon intake, they negotiate with countries that are less developed and try to convince them not to develop. Because if they do, then we will get overheated and this entire climate problem happens. So this is a very risky issue. How do you conduct that process? Because, well, let's talk about Poland. A single Pole uses or generates 8 to 9 tons of CO2. Germans have reduced that. In India, for instance, you've got 1.7. So our Prime Minister Morawiecki has to ask the Prime Minister of India not for them not to develop to the level of Poland or Germany, because if they do, we will overheat. So this is a hypocrisy. This is unjust when it comes to the distribution of development. So final sentence. From me, 47 countries of the UN are the so-called developed north. The rest are the countries with lower level of development. And this is the true drama, because we have to talk to all of them when it comes to development goals in order to handle the climate crisis, the climate change, and somehow deal with it. Thank you so much for your attention.
Wonderful. Thank you very much for Dr. Wyszkowski for this presentation and adding yet further layers of complexity to our discussion this afternoon in terms of talking about cities and then yes, also what needs to happen. And unfortunately, we've run out of time to discuss further this afternoon. But I wanted to say that this is only the beginning of our series. We're having further webinars where we will come back to the issues that were raised here today, including questions we had from our participants on what can the doctors do, what kind of capacity do they have, what kind of awareness raising do we need to do, and then we will actually have a specific session on cities in 2 weeks' time where we talk about the role of cities and what Polish mayors and administration can do. And then we will, in 3 weeks' time, we will have a session where Poles can ask doctors on any question on climate change and health they have. And I'm thinking we should actually, since we could only really raise issues on what needs to happen, we should actually have another discussion on all of these things, because there were so many activities mentioned in this afternoon. And I wanted to thank all of you presenters for giving us your time and your views here this afternoon. It was really incredibly rich. And as I said, we are recording this webinar. It will be available on YouTube in both English and Polish for people to watch, and I'm sure many people will do so. And I would like to close this webinar with a word of thank you to our wonderful interpreters, Anna Tchaikovska and Magda Fidesz-Dukaszewska, for leading us through this afternoon. This webinar would not be possible without you. Thank you very much. It was a very good translation. I want to thank all of you participants for being here this afternoon and invite you to join again next Tuesday at 4:30, where we speak specifically about the health community. What can the health community do, and how can we learn from each other, from health community in Europe and internationally with the Polish doctors and public health professionals. So looking forward to that further exchange, and I wish you good evening. Thank you very much. Bye-bye.